By looking at the served data, we can see that as the power increases, our VO2 changes. This is due to changes in the spirometer meter graph, and because we need more oxygen to supply our body. This means we work harder, causing our breathing rate to go up and our tidal volume, which affects ventilation. In exercise, the tidal volume increases as we are taking deeper breaths. This affects the inspiratory reserve volume, which is here. As we are exercising, we bite into this oxygen, and this is used up by the tidal volume. This tidal volume shows that we are using into the inspiratory reserve volume. The expiratory reserve volume also takes an effect as we are breathing more, which means this will become smaller from the tidal volume increasing as well, which is shown here. So MMVPA stands for muscle and movement, volume, pressure and airflow. This is used to explain our breathing and the mechanics used during it. At rest, while we are breathing in, the muscles contract, causing the ribs to be pulled up and out. This creates more space within the lungs, allowing a higher volume within the lungs. As there is more space within the lungs, the pressures decrease due to the air already in the lungs having more space to spread out. The airflow is into the lungs during this as we are inspiring. When we breathe out, this changes. The diaphragm and external intercostal muscles relax, and the ribs are able to move in and downwards. As the ribs are being put back into place, this makes the lungs smaller, which means the volume changes. This decreases due to the smaller space. Pressure increases as the air is more compact together within the lungs and the air flows out. Unlike inspiration, this is a passive movement, while inspiration is an active movement as the muscles are contracting. This changes at exercise though. There are more muscles which help with inspiration, such as sternocleidomastoid, scalene muscles, and the pectoralis minor. These are accessory muscles which help with a deep breathing. There is also a larger volume inside the lungs as deeper breaths are being taken, and there is a larger pressure reduction. More airflow flows in faster. This states active exercise like it did at rest, as it's still contracting the muscles. During expiration, the diaphragm and external intercostal muscles relax, allowing the movement of the ribs once again. Intercostal muscles contract to force the ribs into the right position. This is why it turns into an active motion, as there are muscles contracting. The rectus abdominis and the latissimus dorsi contract to help this action also. Due to this, the volume is forcibly reduced and the pressure quickly increases. More air is forced out and faster in exercise. There are receptors in the body which detect change in the environment and send the information to the brain. This causes impulses to be sent to the ventilator muscles so the breathing rate can be increased or decreased. This happens as both inspiration and expiration. The DRG is responsible for inspiration. This gets its feedback from the peripheral nerves and then sends an impulse along an intercostal or phrenic nerve to the lungs for inspiration. The VRG is used during inspiration and expiration during exercise. It's an emotional stimuli and gets its feedback from the central feedback. This is a chemoreceptor. This sends an impulse along the two nerves during exercise. The Henning-Brewer inflation reflex is a protective reflex which is placed in our lungs. It is triggered to prevent overinflation of the lungs. There are pulmonary stretch receptors in the lungs which stop the inflation and protect the lungs. This is why it's a protective action. The cardiac dynamic outcome depends on the exercise which is taking place. Due to exercise, there is an increase in heart rate, stroke volume, and cardiac output. Cardiac output is measured by multiplying the heart rate and stroke volume together. A normal heart rate would be around 60 to 80 beats per minute at rest. But if you want to reach your max heart rate, this would be 220 minus your age. The athlete which we studied, the heart rate was 188. A resting average stroke volume would be 70 milliliters per beat. This can rise up to 120 milliliters per beat at exercise. From here we can estimate the cardiac output. This would come out at around 22.56 liters per minute. This can range due to different intensities. At submaximal, all these values would lower. By looking at the graph, we are able to see that the heart rate increases with power. This is due to the heart having to work harder to pump blood out to the muscles during the exercise. The higher the power, the harder the work has to work, meaning the beats per minute increases. We can also see in the cardiac output and the stroke volume graphs, which are here. We can also see this, but yet on the stroke volume graph, it plateaus near its top. This is due to the heart not being able to fill its ventricles anymore. This means this stays at one level and begins to plateau. The heart is controlled by our autonomic nervous system, the SA node. The SA node is automatically sending out impulses to our heart to contract. Blood pressure is the amount of blood being exerted from the heart against the side of the blood vessels. Blood pressure can be impacted by the cardiac output and to any resistance in our bloodline. Resistance can be caused by the thickness of the blood, the type of the vessel it's training through, and our diet could affect the size of our vessels too. Blood pressure affects cardiac output due to the size of the vessel. If the pressure in the vessel increases, the blood flow will be easier and it will increase and vice versa. If the vessel resistance increases, the blood flow will decrease. Exercise can affect the pressure also. If we are pumping more blood out due to the muscles needing it, the pressure will increase as there is more blood flow and more blood pushing against the walls of the vessels. Normal blood pressure levels are around 120/80 at rest. From the blood pressure graph, we are able to see our athlete's blood pressure level during different types of exercise. For submaximal, it was 124/106. For maximal, this was 175 and 120, which we can see here. And for the isometric, it was 118/70. From this data, we are able to see how blood pressure ranges from the different type of exercise and the intensity of each of them.